Marynne Spurdle from Maxim's been doing the research. Marynne, kia ora.
Good morning, Andrew.
It's, well, in terms of reading the details of legislation, I mean, yeah, that can be quite complex anyway. But in terms of these details, it's life and death stuff, right?
That's right. It's being marketed as one thing, but when you look at the details, we're definitely, in fact, it says explicitly in there, oh, this is what Canada's done,
Yeah.
and what one of the states in Australia has done only months ago. It's interesting because the debate initially, before this became law here, was no, 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 we're not going to become Canada. We're doing our own thing. We're going to make it the safest in the world.
Yeah.
And now it says explicitly, oh, this is what Canada's done. Specifically, 5 years after implementing euthanasia, they opened it up. So there wasn't a 6-month prognosis that was required. It was opened up to what they call track two. Here, we're 3.5 years in, and they're opening it up in this legislation to those who don't have a 6-month prognosis. The new criteria would be to be having a condition that is advanced, progressive, and expected to cause death. That's a lot of different people.
Yeah.
It also would remove the requirement that doctors only discuss it with patients who bring it up. The idea being you don't want to tell a patient, hey, you might be better off dead than dealing with what you're dealing with. We all know that it's legal. If somebody wants to access it at the moment, they have to bring it up with their doctor. This bill would remove that so any doctor could suggest it to any patient who might be eligible, which is a lot of New Zealanders
Yeah.
who could be blindsided with this idea of, how would you like to pursue euthanasia? That's what Canada has done. Canada is, at the moment, planning to open it up to people with mental health problems
Wow.
in the next couple years. I mean, if we're on track to become Canada, that's the next step for us after this bill. So the whole slippery slope thing is not scare tactics. We are exactly doing what Canada's already done. You brought up Amanda Uckman. She and
Yeah.
others from Canada are saying we're not happy with the way it's going. Physicians aren't happy with the way it's gone. Disability rights activists are very much unhappy with the way it's gone. And that's exactly what we're on track to do here with this bill.
It's difficult, I suppose, for me to get my head around how people can look at what's happening in Canada and their responses, isn't this great? We want to be like them, given all the problems that this legislation has caused and given the impact that this is having on society and culture in that part of the world.
Yeah, I mean, it's really well documented that there are people applying for what's called MAID in Canada, medical assistance in dying.
Yeah.
There are people who are applying because they don't have their basic needs met. They've got disabilities, they've got other problems. Life is very hard. And rather than the system make sure that those things that they need are in place, they're going, well, aren't we compassionate to give them a way out? And that's, I don't think, compassionate. One thing Canada does do that we have not done and there's no plans to do, they actually survey people to find out why are you applying for assisted dying.
Yeah.
We don't do that. In places where they survey people, by and large, the reasons are not I'm suffering unbearably from pain that can't be eased. The fear of suffering from physical pain is really low down the list.
Yeah.
It has to do with autonomy, fear of being a burden. These are things that can be addressed. When they survey people, the answers are, I'm suffering from something that could be addressed. It isn't being, and so people are applying for assisted dying. Here, we're not even asking, what is it that your actual problem is? Is there something we can do before we refer you on to kill yourself?
Do you think that that's something we should adopt here in New Zealand? Is this one example of what the Canadians are doing that maybe we should take advice on?
Yeah. I mean, not finding out why people are applying to have themselves killed is basically going, we don't want to know.
Yeah.
Yeah.
Not that the Canadians are taking any notice. I mean, they're getting all of this information, they're asking the questions, and then they're going, what about disabled people? What about mentally ill people? Let's include them as well so that we can get their research and then they can have a lethal
Yeah.
injection, basically.
And the problem is it's been reframed as, well, this is a compassionate option. It's an option as good as any others. We're at least providing them with an option. And so now, there was a survey in Canada, I forget the exact numbers, but it was nearly a quarter of respondents. We're fine with opening up euthanasia for the reason of homelessness.
Wow.
like a significant percentage of the population was like, oh yeah, at least give them, without thinking, actually, there are ways to address the problems these people are dealing with. Killing yourself is not an option as good as any others, especially when it's the government opening the door. And this is my problem with reading this bill is it makes it safer for people who are providing euthanasia and less safe for people with disabilities,
Yep.
people in care homes, and people who don't want to participate. So what it does, it would actually create no euthanasia-free spaces because every single care facility, rest home, hospital would have to allow it on site.
Hmm.
All the person applying for it would need to do is have a doctor say, yes, it would be too problematic to move them, and the care home is required. It doesn't say in the legislation what the repercussions are if a care home goes, no, we're not going to allow access on site. But in the Ministry of Health's review last November, it said that they should be required to or lose their registration.
Yeah.
This bill doesn't clearly define what the repercussions are going to be, but the intention is very heavy-handed. Now, what this means for people who work in aged care, people who are residents there, is they don't have an option to be in a place where euthanasia doesn't happen.
Mm.
We know that the one hospice that does allow it on site, and only one of all of them does so far in New Zealand,
Yeah.
when it made that decision, they lost their charge nurse and they lost over a dozen staff immediately because those people didn't want to work in a place where euthanasia was happening.
Yeah.
If we mandate the entire sector, what impact is that going to have on our workforce? That's just one hospice, what happened there. This bill wants to mandate the entire aged care and hospice and all the rest care to allow it on site.
Yeah.
This is not what physicians want, by and large.
And hey, it turns aged care into taking care of a problem that society sees. I suppose my biggest concern, and certainly looking at the situation in Canada, is the impact that this has on society and that it normalizes, that it goes from going, hey, yes, perhaps in extreme circumstances to avoid suffering, to, no, this is the preferred way that people want to die as a society. This is something which people can plan and control, and this is becoming the norm rather than the exception in Canada now, right?
Yeah, I mean, it's seen as a preferred way of death,
Yeah.
which is tragic because not that any of us look forward to dying, but there is nothing about natural death that is more scary than having a lethal injection.
Yeah.
But it's being framed as, oh, you don't want to have to go through that now, do you? And that's just planting fear in people's minds unnecessarily.
In terms of the legislation, where to from here? Because, okay, it is, you've read through the fine print, it is officially in the tin, it gets drawn, it gets debated. Is there possibility for amendments? Of course, it would need to be supported by all of the coalition partners. This is going to be a conscience vote. Even if it does pass, it's select committee, there's amendments. This it's not a take it or leave it. There's still some robust conversations to have on this, right?
That's right. So none of this is a done deal, which is why for people who've got issues with it, it's important to let parliamentarians know these are the things that I find problematic and why, so that if it does come up, I mean, it could just not get pulled, but
Yep.
the original bill that legalized euthanasia here was also a member's bill. It didn't sit around in the tin long, and we have euthanasia.
Yep.
Now, that was marketed as it's going to be safe. We have no intentions of, crossing these certain lines. And we're only 3.5 years into this being legal,
Yep.
nearly 4 years, and already these things are on the table. So I think just being aware that this could happen at any time, all of these changes are going to be pushed. And it is a conscience vote. There are a lot of people who are not paying attention to the details, who think, well, if it's fair for this demographic to have access to it, then why not this demographic? Because that's a logical argument.
Mm-hmm.
However, there are very many good reasons why we don't want to open this up to people who just have disabilities or go down the route of Canada now, people with mental health issues. People with mental health issues should automatically be excluded from wanting to access suicide
Yep.
because they clearly need support mentally. Like there are arguments here that are very clear, but once the lines are blurred, people are just kind of like, well, we've got it, why not?
Yeah. No, it's I certainly appreciate the work that you've done, reading the fine print, going into the details, bringing this to our attention here. Certainly something to watch, to pray into, and to contact local MPs if there's a conscience vote coming up on this one. Marynne, thank you for the work that you do at Maxim. Thanks for joining us today.
Thank you, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.